The reason that scoliosis is so difficult to treat is because it involves tissues in the entire body. And the medical system is not so great at treating full body conditions. It's actually more of an art than a science, because if you look at scoliosis as a left-right imbalance in the body, what we want to do is our best to restore balance. And restoring balance is not a great thing to measure because it involves being neutral. And if we have tight muscles over here and tight muscles down here, and it continues up and down the chain in a pattern like that, there's not a lot of measurements we can take or exact things that we can do. What it really involves is you going on an exploration of your body to find the tightness, find the weakness, and then address it. And not a lot of other people can do that for you. So in this video, I'm going to share with you two of my favorite exercises for finding and treating left and right imbalances in your body. One is for the lower body and one is for the upper body. But these are not the only two exercises. In fact, I encourage you to try and hit scoliosis from every angle that you can to restore balance. So I'm going to use this lower body exercise to help explain to you the strategy that you want to take when approaching a left-right imbalance in your body. So this exercise is a heel tap or a heel touch, where you're going to stand up on a step or a box like what I'm standing on, and you basically just want to do a mini single leg squat with your standing leg to touch your heel or your foot down to the floor, using primarily your leg muscles and not leaning or tilting or tipping your pelvis as a compensation. You want to rely on your leg strength. And the strategy that you want to take with this exercise, and really any exercise that you're going to be using to address a left-right imbalance in your body, is you want to be using a unilateral exercise, or one that is asymmetrical, so you can test the left and the right while doing the exercise. And so you experiment with it as kind of a diagnostic tool, and that exercise will tell you which side is stronger, which side is weaker, which side has more endurance, which side has better balance, and which side just feels more confident for you. And so when you discover, oh, I'm much stronger on my right leg than my left leg doing single leg squats or mini heel taps, then what you want to do is you want to focus all your efforts on the weaker side, or the side with less endurance, and work on that side day after day, week after week, until you get the left and the right sides of your body to feel more or less similar. So while this is only one exercise to address a left-right imbalance in your body, it's a really good one because it is a complex movement that involves the full body, and especially the ankles, knees, hips, pelvic muscles, and trunk and core muscles working synergistically, which is what you want, and it really exposes weakness in either the left or the right leg of your body. And so it's very easy to tell which leg is your dominant leg and which leg is the one that needs to be worked on. And so for that reason, I really love these heel taps as a good starting point to discover and then treat the left-right imbalances in your body. So with scoliosis, we're not only dealing with leg and pelvic imbalances, but we're also dealing with the upper body as well. And so I found that hanging is a great way to not only find left-right imbalances in your body, but to also then treat them, because stretching alone is not enough to make changes in the body. We need to make changes not only in the length of muscles, which stretching attempts to do, but also in the neuromuscular system for motor control, for using the muscles, because muscles need direction from central command in order to learn how to be. And a muscle's not going to change the way that it rests or the way that it holds your posture unless it's being directed to do so through your brain and nervous system. So hanging allows you to tap into that system and give your body some commands. So notice that my feet are on the ground and I'm not actually fully hanging here, and that's what I would recommend for you, because full hanging is going to be too intense. And so you want to do a modified or a percentage of your body weight into the bar or whatever you can hang on. And so right now I'm just going to sit down a little bit into my body weight and allow maybe 20–30% of my weight to go into my arms. And I'm going to feel left to right. I'm going to lean into my left side, feel how tight that feels. I'll lean into my right side, feel how tight that feels. And the tightness I'm going to be feeling is right here in my lats, on the outside of my shoulder, maybe into my side. If you shift your hips over, you can get some feeling of tightness or stretch into the side of your torso. And so these are the types of things that you want to do to explore and find the tightness, because there's always going to be one side that's tight and one side that's lengthened with scoliosis. So let's say that my left side is the side that I'm finding some tightness just by sinking into it. It feels tighter or more, I feel more tension than when I sink into my right side. So this is the side I'm going to want to work on. I'm going to want to lengthen this side. And instead of just sinking into it and stretching it, that would be just a stretch, a passive stretch. What I want to do is I want to sink into it and then activate it. So I can actually retract my shoulder blades and do little movements that use the muscle, sending signals from my brain through my neuromuscular system into the muscle to learn how to function in this stretched or lengthened state. And that's how you're going to get the more long-term effect of what you're doing. And so you can go more intense, go maybe 50% of your body weight, even 90–100% of your body weight if you want. And you can actually train other areas of your body too in this lengthened state. So let's say I want to sink into my left, get the length through the side, shift my hip over, get some length through my flank there, and then I can do some maybe core training or leg lifts to train those muscles in a lengthened state. And so this is really just an exploration that you would go on into your own body and searching for tightness, for tension, and then working into that with movements. Nothing is super intense. Nothing is abrupt or explosive. This is training for normal daily life, which is low intensity, long duration stuff, like standing, walking, sitting. And so you kind of want to mimic that. It's called specificity. You want to train for what you're doing. And once you get maybe a little more balance in the left and right sides, say a few weeks into this, I'm feeling more even on my left and right sides, then you can start to progress into more high-level things. Another angle that you can attack this with is if you step back away from the pull-up bar and hinge forward. And now you're going to just get another type of tissue to lengthen, a different angle to the stretch, and really do the same thing. Find the tightness, explore, and then sink into it. And once you sink in, activate. Pull on the muscle. Create tension in the muscle, because tension is the language that muscles speak. So if you want to talk to them, you have to speak in their language. So pull tension into the muscle in that lengthened state, so it learns how to function and it can feel safe to go there. And so going at this scoliosis or these left-right imbalances from all angles is what you want to do. This would be a few different options for the upper body. We have the lower body, which you can address with the heel touches. You can do those from different angles. And there's also lots of other ways to attack scoliosis with exercise. So for example, side plank, single leg bridge, single leg squat. Notice all of these are going to be one-sided or unilateral exercise where you can compare the right and left sides, and then you can work on the side that needs the work. You can strengthen the weaker side, add more endurance to the side that needs it, and try and balance out the left and right sides of your body. So like I said, you want to address scoliosis or left-right imbalances in your body from all angles, which means you can apply this strategy to any unilateral or asymmetrical exercise that you know of to balance out the strength, endurance, and length of muscles on the left and right sides of your body. And this is a long-term process. This may be a lifelong goal for you to continue to strive for balance. So I encourage you to explore, and I'll be back next week to talk about a different topic related to getting out of the back pain cycle for good. And until then, get down on the floor and connect to your core.